Hi, my name is Nikesh Parekh. I'm a GP at Newtown Medical. A lot of men in their older ages will have prostate cancer. However, there are groups that are at higher risk. We know that in Aotearoa, New Zealand, that the Maori population is at higher risk of dying of prostate cancer and less likely to be diagnosed early. We also know that people of black ethnicity are at significantly higher risk of having prostate cancer. And if you've got a first degree relative, a father or brother with prostate cancer, particularly when it's diagnosed at the age of less than 65 years old, that increases one's own individual risk. It's very much a discussion to have with the GP as to what is the most sensible approach to screening an individual for prostate cancer with a PSA test, then making a shared decision around that. The prostate is a gland. It's a male sexual gland which sits just under the bladder and in front of the rectum. Traditionally, we have always done a PSA blood test alongside a finger examination. There's a real shift away from that because there's a recognition that in many cases a PSA test will be sufficient, and again that will be a discussion with the GP. There's a lot of men that won't go to their GP because of the concern of having a rectal examination. I would urge people not to put off going to their GP to discuss prostate cancer because of a concern that the GP is going to want to examine, because that is not always necessary. There are what we call lower urinary tract symptoms. All of these symptoms are common as we age because the prostate gland gets bigger. That does not necessarily correlate with somebody having prostate cancer. However, if there are those symptoms going on, then that in itself is a discussion to have with the GP. I would not recommend everybody to have the screening. The reason for that being that there isn't evidence that that would improve quality of life for people, and it would lead to a lot of overdiagnosis and overtreatment, which has its own potential harms. But that prostate cancer would never have an impact on their chances of dying. They would die with prostate cancer rather than of prostate cancer. The reason this isn't a national screening program is because actually there isn't good evidence for a screening program. That discussion about whether someone needs to have a screening test should be a shared discussion with their GP. They can give you all the information and you can make an informed choice as to whether you want to go ahead with having the prostate screening tests.